Hey Yorba Linda, so today's episode is going to be all about teeth. So if you're on the younger side thinking about getting your wisdom teeth removed, or on the older side thinking about some alternatives to dentures that are a little bit easier to take care of and a little bit more functional, then you're not going to want to miss today's episode. So on today's Yorba Linda Spotlight interview, I'm going to be sitting down with Dr. Daniel Yang, and he is the owner of Yorba Linda Oral Surgery. So we're going to be going over a lot of different topics, from why he chose to move his family here to Yorba Linda, as well as what type of services he offers and when you should go to see him. So let's go ahead and get into it. Hey everybody, welcome back to the show. Today I'm here with Dr. Daniel Yang from Yorba Linda Oral Surgery. So thank you for joining me. Thank you for inviting me to this beautiful office of yours.
Thank you for having me.
Absolutely.
Yeah.
So the first question I always like to ask before we get into the actual business side of things, I want to get Yorba Linda to know you a little bit better. So can you kind of give me some background, who you are before you came to own this practice?
Yeah, so I'm a board certified oral and maxillofacial surgeon. So that means that we're kind of in the middle between dentistry and medicine. So I hold both degrees, both a dental degree and a medical degree. And we do a lot of surgery, so as the name implies.
Yep.
I'm from Michigan, and I did my dental school at Loma Linda. So that's how I first was introduced to Southern California. Then I went to Dallas to do some more training. And then my wife and I decided to move here to Yorba Linda.
Gotcha.
Yeah.
So how many years of training, with that dual degree, how many years were you in school for that?
10 years after college.
Okay.
So 4 years of college and then 10 more after that.
Wow, impressive. Okay. So you came here, so you got all the degrees and everything. Did you start immediately by owning your own practice? Did you start somewhere else? How did you kind of get into this field after you got your degree?
Yeah, this practice was a pre-existing oral surgery office, and I took it over. And so it wasn't a cold startup, but it was an existing practice, which from there we tried to grow it and remodel the place, and now I feel like it's truly sort of mine. Yeah.
Okay. And then before we get too much more into the business, just in terms of yourself, do you have a family? What do you like to do outside of being here? I'm sure you're probably here most of the time, but outside of actually working, what do you like to do in your spare time as well?
Yeah, so I am here a lot, 5 days a week.
Yep.
But in my spare time, of course, spending time with family. I have 2 young daughters and my wife. Besides spending time with them, I like to fish a lot. So I go out into the ocean and fish for tuna, yellowtail, and all kinds of other fish. And then everything outdoors. One of the things that drew me to this area was the mountains are right here, the ocean is right here, and it's
a little bit of everything.
Everything.
Yeah. Okay. And how old are your daughters?
My daughters are 6 months and 3.5.
Okay, so it must be a handful at that age. I've got 2 of my own. So.
Yeah, it's a fun time though.
Gosh.
Yeah.
So you kind of went through the whole process of talking and kind of getting things renovated here. So what really inspired you going from maybe I'll work at an office versus no, I actually want to own my own office and own this whole thing? Yeah,
I thought about working for someone else, but I knew that sooner or later, in my heart, I was a small business owner, and I knew that, and I figured, why not just take the plunge right from the get-go?
Yeah.
And it was like drinking out of a fire hose at first.
Sure. Yeah.
But I learned, and I'm still learning.
Gotcha.
But I just really love the freedom to do whatever I want to do in terms of how I practice. No one's telling me that I have to work weekends or that I have to use certain supplies. It's just the freedom involved in that. And so that's why I really enjoy being a business owner.
Okay, so in terms of that entrepreneurship type of thing, were you thinking of that even before you even started getting into medical school? Was that something you had more like, hey, I was a tiny kid, I want to own something one day, or did that kind of eventually come about once you started going through medical school?
I think I always had a bug, that entrepreneurship bug.
Yeah.
I have experience selling things door to door.
Okay.
So I did that when I was in high school to make some books.
Books, okay.
Yeah. And then I also started selling some things on Amazon.
Okay.
While I was in medical school, actually, as a side hustle.
Get some extra money.
Yeah. So I think I always kind of had that itch.
Okay.
Yeah.
So let's go ahead and actually start talking about the business now. So if someone was to walk in here for the first time, can you explain what this whole office is? What do you offer here? Why should someone come into your office?
Yeah, so we do a lot of dental surgery, and all the way from simple things like tooth extractions to more advanced things like full mouth dental implants.
Okay.
And utilizing a lot of the technology, we're able to bring a lot of really great value to patients that need dental surgery that maybe their dentist is not comfortable with doing a certain surgery, and so that's where I come in.
Okay.
You don't need a referral to come to my office, but most of my patients come from referring dentists for advanced surgical care. Yeah.
Okay, so what are kind of the most common procedures that people are coming here for that you really operate with?
During the summertime, a lot of teenagers come through for their wisdom teeth,
Gotcha.
which I definitely recommend that anyone watching this with wisdom teeth should get that evaluated.
Okay.
But we also tend to do a lot of implants, so dental implants where we're replacing teeth with implants, and at the sometimes we do this procedure called all-on-4 or all-on-X, where we're removing terminal teeth and then replacing them with implants. And utilizing technology and 3D printing, we're able to provide teeth to patients immediately after the surgery on the same day.
Wow.
So you walk in with bad teeth, you leave with a full set of teeth, and just like a lot of people have seen the commercials.
Yeah. So there's a lot to unpack there. So first, let's go over the wisdom teeth portion of it. So for wisdom teeth, is there an optimal time to be able to get those out? Should you be getting them out when you're young? Should you wait till you're older? What is kind of your recommendation for that?
Absolutely, there's an optimal time. Usually between the ages of 15 to 17, usually at that point, the wisdom tooth is about 75% of the way formed. Okay. So when you remove them at that point, your recovery is way better. It's usually just a couple of days of having to take some sort of pain medication, and it's an easier surgery also, and there's less bleeding, there's less downtime, and so that's one of the main reasons why having them while you're a teenager is important.
Okay. And then it kind of sounds like on the opposite age scale, you're looking at in terms of replacing teeth, possibly the entire mouth. Does that sound correct in terms of everything on there?
Yeah.
So if someone was kind of getting to the age where they're kind of looking at these options, I'm guessing they're probably looking between implants and maybe dentures. Is that probably pretty common for trying to figure out which is going to be better for them?
Yes.
Okay.
Yes. So I'm definitely biased towards implants.
Okay.
I believe teeth should stay in the mouth and not flop out when you're laughing, and dentures actually cover the palate and reduce your taste buds. Actually, a lot of people don't realize that, and it can impact your speech as well. So implants are a superior option in my view. Okay,
so someone's trying to debate the two on there. Is there any other big benefit of implants over dentures if someone's trying to figure out between the two which one to go with?
In terms of longevity, the implants actually will preserve your bone once they're in. And contrast that with dentures. Many people associate dentures with sort of their grandma and sort of that aging look where the face tends to shrink. Well, that's because the bone is actually shrinking. And with dental implants, because there's stress being transmitted to your bone, the implants actually stimulate your bone and prevent them from shrinking as much.
Interesting.
Yeah.
So in terms of if someone wanted to do one of those implants, what is kind of the process they go through? Is that a long procedure? Is that they come in for an hour?
Yeah.
What does that really look like?
Yeah, for that big full mouth procedure, we always do a consultation first. And that consultation involves going through the entire process, X-rays, meeting me, and it's all free of charge.
Okay.
And so that'd be the first step if you think you're a candidate for that.
Okay.
As far as the surgery itself, we typically close the office because it's a big surgery. It's usually about 6 to 7 hours.
Oh, wow, okay.
So we close the office to other patients, and we only focus on that individual, that patient that's getting the procedure done. Okay. And then we have a whole team, our designer, our finisher, anesthesiologist, they all come in, and it's a team effort to get a big project like that done.
Okay.
Yeah.
And then once they are in, what does the maintenance look like between that and, like, let's say dentures? Is there advantages with that side of things too once they're actually in the mouth?
Yeah, so you don't have to take your teeth out and put in a jar of water every night. That's
makes life easier,
so yeah. In terms of maintenance, it's every 6 months. It's just like a regular cleaning.
Yeah.
But every 6 months, you come back to the office. We take the teeth off and clean everything and put the teeth back on.
Okay.
Yeah.
So it makes it pretty easy.
Yeah, very easy.
All right. Well, I learned a bunch of stuff here today. So everybody at home, whether you're on the young side looking at getting your wisdom teeth removed, or on the older side looking at the options between either going with a denture or going with an implant, and you want to get some more information and figure out which one's going to be right for you, Daniel is a great resource for that. So make sure you stop by, talk to him and his team. Again, the consultations are free, so if you need that consultation, he's able to do that for you and be able to make sure you get the right service for what you're looking for. So thank you again for joining me today, and until next time, stay happy, stay healthy, and I'll see you on the next show. Bye, everybody.